Welcome to the Metabolic Audit Masterclass with Dr. Gurpreet Singh Padda. You walked in here looking for a needle. That is not a criticism. That is the programming. For decades, the medical system has trained you, the patient, to believe that if you have pain, you need an intervention. If your back hurts, you need an epidural. If your knee clicks, you need a steroid shot. If your shoulder is stiff, you need a manipulation. This is the industrial assembly line medical model that treats pain as a localized structural defect rather than a systemic biological signal. We have been conditioned to view our bodies through a purely mechanical lens. We treat the symptom as the problem. We look for the quick fix that will get us back to the desk, the golf course, or the operating room. But I am here to tell you that the most important procedure we perform in this clinic does not involve a needle. In fact, it doesn't involve any physical intervention at all. It is the foundation of metabolic sovereignty. It is the most critical step in the entire patient journey. I call it the metabolic audit. Most clinicians are flying blind. They look at an MRI, a snapshot of structural anatomy, and they make a decision based on what they see on a screen. But an MRI is a static image. It tells you nothing about the why. It tells you nothing about the biological terrain, the metabolic markers, or the systemic inflammation. An MRI is a static image. It tells you nothing about the why. It tells you nothing about the biological terrain. It tells you nothing about the chemistry of your blood or the capacity of your cells to regenerate. If you attempt to perform a regenerative procedure without first understanding the systemic metabolic environment, you are essentially gambling with your own anatomy and wasting your biological capital on a high-risk intervention. You're planting a seed in soil that you haven't tested. You are building a house on a foundation you haven't inspected. Without the audit, you are essentially flying into the storm without a flight plan. Let's look at the gap between the imaging and the reality. When you come to regen.md, you have likely brought your imaging with you, hoping for a simple injection to cure complex degeneration. You show me the bulging disc, you show me the narrowed joint space, and you ask, "Doc, can you inject this?" And my answer is almost always, "I can, but should I?" The standard of care in orthopedics and pain management is to treat the visual pathology. If the MRI shows a tear, they fix the tear, completely ignoring the cellular health of the surrounding tissue. But the MRI does not measure your C-reactive protein. It doesn't tell me your HbA1c. It doesn't reveal your lipid peroxidation status. It doesn't show me if your mitochondria are functioning at a level that can support cellular repair. This is where standard orthopedic models collapse under their own analytical deficit, leaving patients in a state of chronic, unmanaged systemic breakdown. We look deeper. We must analyze the biological soil, your LDL-P, TNF-alpha, IL-6, IL-1 and HS-CRP. When I perform a procedure, I am demanding that your body builds something. Whether it is new collagen, new cartilage, or new tendon integrity, I am asking your cells to do work. But what if those cells are starved? What if they are starved of crucial nutrients and drowned in inflammatory markers? What if they are swimming in a toxic pool of systemic inflammation? What if your blood sugar is effectively caramelizing your connective tissue through advanced glycation end products? If you inject regenerative factors into that system, you are throwing precious resources into a fire. The systemic inflammation will consume them, and the procedure will fail, leaving you back at square one. The procedure will fail, and then you will be told by the mechanical orthopedic paradigm that regenerative medicine doesn't work for you. It didn't fail because the science was wrong. It failed because the audit wasn't performed. We failed to fix the terrain. We must look at visceral fat, central obesity, as the strongest metabolic predictor of chronic pain and meta-inflammation. We address metabolic syndrome, metabolic psychiatry, and brain energy failure. We look at visceral fat, central obesity, as the strongest metabolic predictor of chronic pain and meta-inflammation. We prioritize metrics like the metabolic score for visceral fat, METS-VF, and the visceral adiposity index over BMI. BMI is a lazy, outdated metric that fails to capture the true toxic lipid load of central adiposity. We look at the leptin mechanism, non-alcoholic fatty liver disease, the trigeminal mast cell axis, and the NLRP3 inflammasome. This is the biological complexity that standard orthopedics completely ignores. Standard clinics want to inject your knee while ignoring the lipotoxicity that is actively destroying your cartilage from the inside out. This is why we perform the metabolic audit before any intervention. In our metabolic protocols, we do not simply rely on basic diagnostics. We actively orchestrate tissue repair using advanced peptide therapy. We segment peptides into powerful clinical categories. The metabolic masters, like GLP-1, agonists to control systemic lipotoxicity, CJC1295 for cellular reanimation, and the Wolverine stack utilizing high-purity BPC-157 to accelerate angiogenesis and cellular migration at the injury site. We also deploy mitochondrial restorers like MOTC-C and SS-31 to protect the mitochondria from retrograde signaling and oxidative stress. For longevity protocols, we introduce epidolon to modulate telomerase activity and push past the Hayflick limit. This is how we biologically precondition your body, turning a catabolic, degenerating environment into an anabolic, highly receptive, regenerative terrain. To further accelerate cellular repair, we harness mechanotransduction using focused extracorporeal shockwave therapy, or ESWT, specifically targeting VEGF expression in calcific tendinopathy and recalcitrant insertional pain. We combine this with high-intensity class 4 laser photobiomodulation, targeting cytochrome C oxidase inside the mitochondria to stimulate ATP synthesis. This ensures that when we deliver orthobiologics, your cells have the energy to build new tissue. By following the Arndt-Schultz law, we deliver the exact therapeutic dose of photobiomodulation needed to stimulate rather than inhibit cellular function. Whole body vibration is introduced to improve microcirculation and promote bone density. We leave nothing to chance. Every metabolic path, every cellular battery, and every physical signal is optimized to ensure that your regenerative procedure has the highest statistical probability of success. We also must address a silent crisis in pain management: endorphin bankruptcy. Chronic opioid use does not cure pain. It actively shuts down your body's natural endorphin production, creating opioid-induced hyperalgesia, where the nervous system becomes pathologically hypersensitive. When you are in endorphin bankruptcy, any physical stimulus is registered as severe pain. Our audit identifies this neural depletion and systematically reverses it. By resetting the sympathetic nervous system and weaning patients off temporary opioid crutches, we allow the body to restock its natural endorphin reserves. We restore the baseline neural chemistry so that your brain can process sensory inputs accurately again. Pain is not a diagnosis, it is a signal, and we must restore the neural terrain before we can hope to eliminate that signal permanently. Furthermore, we recognize the musculoskeletal syndrome of menopause as a critical, underdiagnosed driver of systemic pain. Estrogen decline directly compromises collagen synthesis, joint lubrication, and muscle mass, leaving women in a state of rapid structural vulnerability. Our audit includes detailed hormonal and metabolic profiling to identify these deficits, addressing the hormonal decline as an essential step in fixing your overall biological terrain. We utilize precise hormone modulation, specific amino acid stacks, and targeted resistance training recommendations to combat sarcopenia, which is the ultimate metabolic sink of the body. Preventing muscle loss is essential for maintaining systemic glucose regulation and joint integrity. We do not treat joints in isolation. We treat the entire hormonal, muscular, and metabolic system of the patient. This is where the analytical strike comes in. At Regen.md, we leverage high-end data processing tools, including our integration with MeasureA.ai. Medicine in the modern age has become an information problem. We are drowning in data, but starving for wisdom. We must transform raw laboratory data into precise clinical intelligence to rescue patients from reference traps. At image_Z9M309 GERS Anchor, you have had labs done before. You get a printout with dozens of boxes. Some are marked high, some are low. You take it to your primary care physician, they say everything looks normal, and you go home. But normal, in the context of standard lab reference ranges, is not the same thing as optimal for high-level orthobiologic healing and cellular regeneration. We don't look for normal, we look for optimization. With MeasureA.ai, we map your biomarkers against a standard of performance required for tissue regeneration, identifying the hidden bottlenecks. Is your insulin sensitivity blunting your repair pathway? Are your inflammatory markers actively breaking down tissue? We track sleep, HRV, and movement cycles to map your true biological capacity. We address glucotoxicity, lipotoxicity, mitochondrial retrograde signaling, glymphatic clearance, dysbiosis, and the gut-brain pain axis. This panel is the procedure. When we run this data, we are creating a map. And without a map, you are not a patient on a journey. You are a wanderer in the woods, hoping that a blind injection will somehow save you. When you have this map, you have a blueprint. We know exactly which nutritional gaps must be filled, which metabolic pathways must be shifted, and which lifestyle factors must be addressed before we ever pick up a syringe. So how do we treat the lab panel as a procedure? It starts with a strict, evidence-based preconditioning protocol. We prescribe a targeted metabolic protocol. We use diet-specific nutraceuticals and peptide therapy, including the Wolverine stack of BPC-157 and mitochondrial restorers like MOTC-C and SS-31 to protect the telomerase, reverse mitochondrial decay, and avoid the Hayflick limit. We proceed to stabilization to ensure your cells can perform the heavy work of tissue repair. We call this the metabolic preconditioning phase. If your audit shows a catabolic state, we do not proceed to injection. We use diet, specificos, and lifestyle to fix the soil. Think of this as the debridement of your internal chemistry. We clear out systemic toxins, sensitize your cells to insulin, and lower the inflammatory load. We utilize elimination diets, Mediterranean and DASH diets, butyrate-producing probiotics, and supplements like omega-3, curcumin, vitamin D, and magnesium. We utilize high-concentration 8% capsaicin patches for targeted nerve defunctionalization in neuropathy protocols. We fix the biological soil, stabilizing the terrain before any interventional procedure is even discussed. We utilize nerve block audits and SGB stellate ganglion blocks with mandatory ultrasound guidance to reset the sympathetic nervous system and clear the autonomic distress signals. We perform these interventional procedures in office without routine sedation, allowing for real-time sensory and motor testing while drastically reducing cost and risk for our sovereign seekers. We employ submillimeter precision for orthobiologic injections, including PRP, MFAT, and platelet lysate for Baxter's nerve, underpower Doppler. We follow a 3-step activation journey and the regen.md stack. This is the procedural integrity required for true biological restoration, ensuring that every injection is landed with forensic pinpoint accuracy. This is why my practice is different. A standard clinic wants to get you into the procedural room as fast as possible. They want the throughput. They want the insurance code or the cash payment. I want the result. If you haven't been optimized, I know I am setting myself up for failure. I reject the industrial assembly line medical model completely. I don't care about the volume, I care about the surgical alternative. And to provide a true alternative to spinal fusion or joint replacement, I must ensure that your biological hardware is ready to sustain the repair. The audit reveals the answer the surgeon couldn't provide, identifying the precise metabolic blocks preventing your healing. When you undergo the metabolic audit, you are not just getting a blood draw. You are engaging in an analytical process that identifies why you are breaking down. And for many of our patients, this audit reveals the answer they have been looking for, the answer the MRI couldn't provide. Data is our integrity, and our outcomes prove it. I've built my practice, regen.md, on a foundation of data-driven outcomes. I've owned businesses, I've built clinical empires, and I've learned that the only thing that matters in the end is, did we improve the life of the patient? If you want a quick fix, don't come here. We are not a drive-through clinic for temporary steroid blocks. There are plenty of clinics that will be happy to take your money and give you the injection you want. But if you realize your health is your most precious capital, if you are ready to stop treating yourself like broken machinery and start treating yourself like a complex biological system, then you are exactly who we are looking for. We seek sovereign seekers. Understand our commitment to the metabolic audit. Use the data we provide through tools like measure.ai to see your own health in a way you have never seen it before. Request a concierge evaluation. Let's stop guessing. Let's start measuring. And let's see if your body is ready to heal, fixing the biological terrain. The needle is the easiest part of my job. Anyone can put a needle in a joint. The hardest part, the part that requires decades of experience and an analytical mind, is knowing what is happening inside your system before the needle ever touches your skin. We stop guessing, start measuring, and restore biological sovereignty. Go to regen.md, look at our process, understand our commitment to the metabolic audit. Use the data we provide through tools like measure.ai to see your own health in a way you have never seen it before. Request a concierge evaluation. When we speak, we talk biology, not symptoms. When we speak, I don't want to talk about your pain as a mechanical problem. I want to talk about your biology as a restoration project. Let's stop guessing. Let's start measuring, and let's see if your body is ready to heal. I'm Dr. Gurpreet Singh Padda. Thanks for your time and clinical focus. Go to regen.md, look at our process, understand our commitment to the metabolic audit. Use the data we provide through tools like measure.ai to see your own health in a way you have never seen it before. Request a concierge evaluation. When we speak, we talk biology, not symptoms. Go to regen.md. Let's talk about your biology as a restoration project. Fix the terrain. See you in the lab. I'm Dr. Gurpreet Singh Padda. Thanks for your time. I want to talk about your biology as a restoration project. Let's see if you are ready to heal. See you soon in St. Louis. Go to regen.md. Let's talk about your biology as a restoration project. Fix the terrain. See you in the lab. I'm Dr. Gurpreet Singh Padda. Thanks for your time. For concierge evaluations, visit us at Woodson Road, St. Louis, near Lambert Airport.